to another community update regarding the coronavirus and our response to it. The purpose of these community updates is to let the community know information and late information about what is happening. And so we will do that today. We will be fairly brief because we have the fire chief, Danny Smith, who will report to us. He has been the point person of the city for this whole effort, and he will share with us. And then we'll go to Peterson Health and get an update from them. I want you to know that Mark Faust, the superintendent of KISD, will not be on today, but he will be on our next community update. Schreiner University will not be on this report, but wanted to let you know that they are seeing a very strong enrollment for the fall. They are up in enrollment, and they begin welcoming their first students this Sunday. So that's good news. Yeah, I'm actually able to take this off and still be safe, but I want to mention a couple of things and then we'll go to the chief. One is act like you have the virus. If you and I act like we have the virus, we will use our masks and we will observe social distancing and take the other measures so that we are not infecting others. The other thing I want to say, this is all about safety and health, but it is also about our economy. Folks, we need to flatten the curve in Kerr County so that we are seeing fewer cases, fewer active cases, because we have businesses that are struggling, as you well know, because of all of this since March. We need to lower that curve so that people feel more free, not in an irresponsible way, but more free to be involved in the community, to get out in the community and so forth. And in addition to doing businesses with our local businesses, we have so many people unemployed here. Our unemployment rate is down to 6% at this point, but still, that's a lot of folks that are out of work. So what I'm saying is, let's bring this thing down so that we can live a little bit more normally. Again, continue to take the precautions that we need to take. All right, Chief Smith, would you give us a report?
I will. Thank you, Mayor, and let me say good morning to the community. I'll start with an update on the COVID numbers within Kerr County. And as of today, we have 371 confirmed COVID-19 cases for Kerr County. Of that 371, there's actually 48 active COVID-19 cases today in Kerr County. We were notified by the state of Texas on Monday that there was an increase in our death numbers showed up in our DSHS report. We're currently working with the state of Texas to get some clarification on where those numbers derived from. We're not certain that the death count for Kerr County is 4 deaths, but we'll update that information once we've gotten clarification from the state of Texas for you. Just to look back at the previous week, there was a total of 524 COVID-19 tests done in Kerr County. Of the 524, 36 were confirmed positive, giving Kerr County a positivity rate of 6.9% for the week of July 19th through 26th. To take a look at July, the total month in terms of the amount of tests that were done, the number of positive cases, and the positivity rate for the month. The previous week, July 12th to July 19th, there were a total of 1,071 tests conducted in Kerr County, 87 positive, a positivity rate of 8.1%. The previous week, July 5th to July 12th, a total of 472 tests were conducted in Kerr County, 84 positive, a 17.8% positivity rate. And then for the week of June 29th to July 5th, there were a total of 902 tests conducted in Kerr County, 112 positive, positivity rate of 12.4%. So as you can see from the numbers, there's been quite a bit of testing taking place in Kerr County. I would like to caution the public or remind them that there may be a difference in what you're actually seeing on the DSHS dashboard in terms of recovered cases and the case count for Kerr County. And the reason for that is typically there's a lag in the information that you're seeing on the state's website in comparison to what you may see from Peterson or the city of Kerrville or Kerr County. The city of Kerrville, Kerr County, and Peterson are working together in an attempt to provide the community the most consistent and timely information we can regarding our COVID cases in Kerr County. And I would like to encourage our citizens and the public, if you want the most up-to-date information, then you provide that on what's been published on Peterson's website. Just a little more about testing for anyone that has an interest in getting a COVID-19 test. We will have free testing conducted on August 5th at the Youth Event Center, Kerr County Youth Event Center. That testing will not require a pre-appointment. It will be a walk-up testing site. We're working out the details on it now, and we'll provide you more specific information in the near future. Just a little more information on COVID testing. We were informed in an earlier meeting by Shriner University that in an effort to resume campus studies, Shriner University has tested all of its faculty and staff, a total of 223 individuals. And from that sample of testing, there was only one positive case confirmed in Shriner's faculty and staff testing. Finally, I'd just like to wrap up my comments with reminding the community that COVID-19 is still a serious threat in our community. And I encourage the public and our citizens to follow the CDC's recommendations to slow or stop the spread. And you know what they are: wash your hands frequently, sanitize those frequently touched surfaces. For our population that's at risk, those individuals over 65, take the extra precautions. If you don't have to be out in the public, stay home. And then finally, for the entire community, if you're in the public, in public places, public spaces, and you can't maintain the 6-foot required social distancing, then please wear a mask. And that concludes my comments, Mayor. I turn it back over to you.
Let me go back to you just a minute, Chief. Do you have any update in regard to nursing homes?
I do have an update in reference to nursing homes. We were notified of from 2 of our nursing homes in the previous week that there may have been a positive case. 1 nursing home and 1 assisted living facility. We've confirmed that in the nursing home, the case was actually a false positive, but that nursing home had gone through or in the process of testing the entire staff and residents at that nursing home. And then in the assisted living facility, we're still working with that facility along with the state to test all the individuals, both the staff and residents of those 2 facilities.
Thank you, Chief. Now let's go to Peterson Health, Lisa Winters and Pam Burton.
Hi, good morning. My name is Lisa Winters, and very proudly, I'm the Director of Marketing and Community Relations. It's hard for us to believe that we're 2 days away from August, the month, a whole new month. July seems like a blur, well, perhaps for me, but not for the hundreds of hospital greeters, screeners, nurses, doctors, hospitalists, not for Pam Burton, our subject matter expert, who will join us in a minute, really any Peterson Health employee who has dedicated every waking moment to face COVID-19. We've been standing strong on the front line now for 8 months, and we're working together every single second. We may be tired, but we are stronger than ever. We work as a united team each and every day. We are meeting and thinking and improving our processes every step of the way. And we've actually found many blessings in this COVID challenge. To name a few, working with the city and the county and schools and Schreiner University, we have never been more collaborative, communicative, or united. Our own organization has always been Peterson proud and willing to go the extra mile to meet our mission to provide exceptional, compassionate, patient-centered care. But they are no longer just going the extra mile. They have been running a marathon, and they keep the pace up, and they sign up for more. Whatever it takes, they're willing to do. Peterson employees are inspiring others. They're lifting spirits. They're improving lives every single day. We thank the community for your prayers and your thoughts and your letters and these wonderful acts of encouragement. We also want to thank our friends in the media, print and radio, who have helped us get the word out and helped ensure that we can keep you in the loop. I'm going to touch on a few things before I hand it over to Pam. First of all, as Chief Smith shared, and as proof that we're staying on track and keeping the same numbers, as of this morning, July 30th, Peterson Health has tested 3,711 patients. This does not include the 100+ patients that we have started screening right before surgery. We started that about a week ago. Kerr County has 371 positive cases. We added 5 yesterday. We currently have 7 patients who are hospitalized. 1 is on 2 West, a regular medical floor. 3 are on 3 West, and we have 3 in the ICU. Kerr County is reporting 4 deaths. None of these deaths have occurred at Peterson Regional Medical Center, but our hearts and our prayers and our thoughts go out to the families. As Chief said, as the number of cases surge and the number of tests administered seem to double, THS is getting backlogged. Turnaround for results from Peterson Health they average 48 hours. It's now taking the state up to 2 weeks to receive results, which includes testing from the Texas National Guard and other clinics or physicians. That sheer volume makes it very difficult to get results in a timely manner. The numbers that we report on our website are higher, and they're different than what you might see on the state because they are far behind. We report Kerr County numbers as we receive them so that we can keep you, our community, fully informed and current on the COVID spread in our community. Peterson Health testing results, coupled with the counties, are combined and reported publicly and posted on our website each day at about 4:30. Our visitation policy is still in place, and with Governor Abbott's recent executive orders, we will be extending that visitation restriction policy for another 60 days, which takes us through October the 6th. Making adjustments to our visitation policy is one of the hardest decisions that we've ever had to make. We know how difficult it is to limit visitation, but this restriction we know helps helps reduce the spread of COVID and protects our employees and our other patients. We do know how hard it is, but please know that we strive to ensure that our patients are loved and well cared for and do not feel alone or lonely. Our nurses and physicians and ancillary staff have stepped up and stepped in with extra warmth and attention. Again, we strongly believe that these limitations will slow down the spread of COVID. So for a few more important reminders, I'm going to turn it over to our subject matter expert, Pam Burton.
Thank you, Lisa. Good morning, Mayor, Chief, and everyone else. Just as some reminders, we do and are continuing to do the COVID screenings and testings at Peterson Urgent Care, which is located at 1740 Junction Highway. We have seen a spike in testing, and we're averaging around 60 tests a day on many days. So we've increased our staff at Peterson Outreach Clinic to meet the needs of the community. We appreciate the staff who have stepped up to answer those calls. Hats off to all the medical staff and registration staff because they've been so willing to jump in and help where needed. Testing is by appointment only. Please remember that. If you are feeling symptomatic and or have been in direct contact with a COVID-19 positive person, you can call the 830-258-7814 line between 7 a.m. and 7 p.m. Monday through Friday, or 8 a.m. to 4 p.m. on weekends. But don't forget, we do offer our COVID-19 hotline, which is active and open. We have added additional staff and extra phone lines to meet the needs of the community. Please bear with us if you call and are put on hold or have to leave a message. We will return your call. We have registered nurses answering the calls as fast as they can. And like I said, they will return your call. Our hotline number is the main number to the hospital, the 830-896-4200. Please select option 1, Monday through Friday from 8 a.m. to 5 p.m. Just a few more reminders real quick. There's been a lot of questions related to our surge capacity here at Peterson Health. We are prepared and have been in discussions for a long time now. So should that happen, which we hope it doesn't, but should it happen, we're definitely prepared to care for our community and keep everyone safe and secure and at home if we can. Another one is in regards to, are we able to treat some of our patients that are hospitalized with COVID-19? We are able to obtain treatment here when available and if needed for our COVID-19 patients. There are those instances where we might have to transfer them to San Antonio, but we are doing our best to work with everyone to keep our community and our patients where they belong here at home. Remember, I know the chief touched on it, hand hygiene, social distancing, clean and safe. We continue to care. We want you to make sure that you're healthy. So in regards to Peterson Health, we are fully operational. Although Governor Abbott has forced some hospitals to cancel surgical cases due to the alarming upticks in certain hotspots, Peterson Health has not had to cancel surgeries or outpatient services. And Lisa did touch in regards to our screening of our surgical patients. So we're doing this in hopes to maintain and keep this movement going. Not coming to the ER could be critical in many situations, and the missed therapies and wellness visits could lead to more severe complicated conditions if they're not kept. So Peterson Health wants to ensure that that the standards and the cleanliness and our practices and protocols here at the hospital remain at the highest level at all times. We are continually evaluating and improving where needs to be. On June the 19th, Peterson Health made it a requirement that all employees wear a face mask in our healthcare facility. This also included non-clinical staff. So please don't be alarmed if you see us walking around the facility. If you happen to come in a whole bunch of garb, it is what we've put into place to protect not only our patients, our visitors, but ourselves as well. So clinical staff and direct patient care have been wearing masks from the very beginning. But like I say, now you'll see others wearing those masks throughout the facility. We also encourage our employees to wear masks in public areas when they're out and about and cannot maintain their social distancing. We believe strongly that masks can help stop and reduce the spread of COVID-19, and we want to set a good example as healthcare workers out in the community. We also strongly believe in keeping our staff and patients safe, and we have worked all week long to fit test over 552 employees for the appropriate N95 or respirators. This 7-step process makes sure that they have the right protective equipment and that it fits them perfectly. But we're still stopping at nothing to ensure their safety. And as hard as that process is for them, they embrace it. There are positively Peterson and true troopers within the Peterson Health System. Lisa?
Thank you, Pam. Again, one thing that we can't emphasize enough, and Pam touched on it, is when it concerns us when we see people canceling appointments or their outpatient therapy or other appointments that are going to keep them healthy. We realize that many people worry about the spread of germs and the chance of infection and their own safety of their loved ones, but The hospital is probably the cleanest and safest place to be now more than ever. So please keep those medical appointments and please come to your outpatient therapy. We are safe.
All right, thank you very much. Let me conclude this community update by saying what you heard here and what you heard in these past weeks, going back to March, is a community looking at and coming around the preponderance of scientific evidence about what we need to do in dealing with this virus. And what experience has shown across the country and in other countries about how you deal with this. And so that's the spirit in which we come to you, and just be safe out there. Thank you.